we're talking hepatitis today, as I mentioned at the top of the show. A very, significant topic. I mean, it's health-wise, and this is something that if you have, you may not be aware of it. Trust me, you may not know that you have such a virus. As a matter of fact, a deadly virus. So very, very problematic and worrying. And we're trying to find out from Doctor how this whole thing is all about. What exactly is hepatitis? And from a few readings that. Hello, Doctor.
Hello, good afternoon.
Good afternoon. Sorry for the delay, but thanks. We have you online right now, and thank you for joining us on the Africa Daily Show as well.
The pleasure is mine to be with you.
Great.
Good afternoon to your serious listeners.
Right. Today is World Hepatitis Day, so a very important topic when it comes to well-being and all of that. But first of all, Doc, tell us, what is hepatitis?
Hepatitis. Hepa means, in Greek, means liver. Itis means inflammation. So if you gather the two, you put the two together, it means inflammation of the liver.
Inflammation of the liver.
Of the liver.
So
the liver is a vital organ in the human body.
Right.
Located in the abdomen, just below the thoracic cage, the chest.
Okay.
And it has very vital functions for the body, processing nutrients, filtering of the blood, fighting infection, and then helping in clotting issues.
Right.
It also serves as a storage facility for our glucose and the rest.
Right.
So, the inflammation of the liver.
So the hepatitis virus targets the liver, per your explanation. Is that correct?
Sure. When the virus, any of them, gets its way into the liver, it will cause inflammation of the liver. The liver will not be able to act normally. And then it will impair many functions in the body and cause several symptoms and signs and then the rest.
Right. Now, let's talk about how common hepatitis is. I mean, is it a disease? Is it a condition that is very prevalent amongst people, or it's like one out of a group of 10 people?
It's very prevalent. In 2019, WHO's assessment showed that we had 296 million people worldwide living with only hepatitis B. 68 million people worldwide living with hepatitis C. Some other studies done in Africa show that in the world show that about 2 billion people across the world were said to be exposed to hepatitis B.
Right.
Majority of them coming from Africa, sub-Saharan Africa, and East Asia.
Okay.
Where it is estimated that 5 to 10% of the African population and East Asian population, respectively, have hepatitis B. So it means that 5% of Ghanaians should be having hepatitis.
5%?
That is what it is. 5%.
Wow.
That's not a small number.
Absolutely. 5% of over 30 million people.
There is underreporting in our system because hepatitis is not like other diseases that it is mandatory for you to report, just like tuberculosis, HIV.
Okay.
But if we really want to go strictly by, want to open up and take the unreported ones, we have a large chunk of people presenting with hepatitis.
Right. By what you saying, not reported or unreported, is people are not aware that they have hepatitis. Right.
People are not aware they have hepatitis. Some of them are aware they have hepatitis, but they look for other treatment means, forms of treatment which is not documented, and they treat them for other things other than hepatitis, thinking of certain beliefs. And when some of them get to hospitals, you realize that they have come virtually moribund when they had hepatitis that they didn't know.
Right.
So there's a lot of underreporting of hepatitis in our settings.
Okay. Okay.
You know, our medical records in Africa, in Ghana, for instance, is not well established. Hospitals basically work in silos. We don't have a national database for all diseases. A hospital can run and see a disease and maybe will not report. If we are reporting like other countries whereby their databases are synchronized,
right,
for monthly reporting, we would have had a good estimate of how many people are really suffering from hepatitis in Ghana.
Right.
But using that of WHO, we can translate that 5% of Ghanaians have hepatitis.
Good. Right. You made mention of how prevalent it is in Africa, specifically sub-Saharan Africa. So here we'll look. So which type? Because we know of variations. We know the hepatitis A, B, C, and D. Which one is the most common?
The most common from all the data indicates is the hepatitis B, which is very, very common.
Hepatitis B.
It's the one, yes, it's the one very difficult to manage.
To manage, great.
And then it's very difficult to manage, and its transmission is not very difficult.
Okay, it's easy. It's easy to infect.
Yeah.
Someone. One. Okay, right. Let's look at. Let's also look at the symptoms here. Hepatitis A, B, C, D. Do they have similar symptoms, or each type has its own unique symptom?
No, virtually they have the same symptoms.
Okay.
They don't vary. It is the complication after the sickness. If it's not well managed well, what will happen that may vary. But virtually they have the same symptoms.
Okay.
And the various symptoms, the commonest one for all of them are the following: yellow coloration of the eyes, the mucosa, the mouth, the urine. You see that the urine becomes very concentrated, very yellow, sometimes going towards brown. You can have temperature. If it's acute, you can have high levels of fever or temperature. There's what we call losing the appetite. One can lose his appetite. You see food you don't want to eat. As a result of that, the liver is sick too, because it is the one responsible for managing our nutrients. You feel weak and fatigued. The slightest thing, you get very tired. And then the rest. The rise in bilirubin and certain byproducts in the body can give you headache, especially ammonium. It can give you headache. And then you can have what we call itching. If the bilirubin in the body is too much, you can have itching and you scratching your body, and you can have ice on your skin. That is when the bilirubins are very high. It also can cause you joint pain. You have generally joint pain in the body, and you feel that your joints are paining you, like rheumatoid disease, but it is because of the hepatitis. You can normally, many people who have pain at the right side of their abdomen, just beneath the chest.
Right.
We call it the right hypochondrium in medicine. That is the right side of your abdomen, upper part, below the chest.
That's where the liver is located, yes?
That is where the liver is located in majority of people. There are a very slim number of people that have the liver at the other side.
Oh, okay.
Let's say that, yes, generally you have some pain at the right side of the abdomen, upper part of the abdomen, below the chest. You have some pain there. You can have some swelling there as well. If the liver is not working well because of some of the byproducts, because it is also helps in eliminating byproducts, you can have nausea and vomiting. So you can vomit profusely as well.
Right.
These symptoms are mentioned together with dark Coca-Cola-like urine are the commonest of the symptoms, and anybody with this should be thinking of hepatitis.
Okay. So similar symptoms A, B, C, D until you get tested before the lab results could actually specify which particular type that you have. Yeah. Great. At the end of the day, one goes for a test, but then before we get to that, how long, Doc, with per your experience, how long does it take for one to start experiencing these symptoms if one get exposed to the virus? A year, 6 months, 2 years?
No, No, it depends. I think that within a week or two, if you are exposed specifically to hepatitis A, B, you start having some symptoms.
A week?
Hepatitis C, a week. But I think it's hepatitis A, a week you can start having symptoms.
Okay.
Yes. The B can take you about 2 weeks, getting to 1 month. The C can take you about a month to start getting the symptoms.
Okay.
People who have other comorbidities already can have the symptoms even earlier.
Right.
When the liver was already sick of something else.
Yeah.
Can already start having the symptoms. So let's take it that roughly within 1 month, everybody should have symptoms.
Right. After symptoms, you've tested, you're positive, or you've gone to the hospital and they've asked you to go do a couple of tests, you realize you have hepatitis. Is hepatitis curable?
Yeah, if you go and test, it could be the A, B, C, E, it could be any of them. Hepatitis is curable to a large extent.
Right.
Specifically, if you are able to catch it early, you'll be able to cure it. Hepatitis C, for instance, if they diagnose it very, very early, you can take some tablets and for 8 to 12 weeks, and you can cure it completely.
Right.
That's the C. If you don't do that before the 12 weeks, then it gets worse, then it might turn up into something else.
Right.
For hepatitis B, there are medications, and there is a mode of prevention for hepatitis B. You can get the vaccine during birth, or if you didn't get it during birth, your infancy, or when you are adult, take your vaccine. It can prevent you from getting the hepatitis B. But if you are also positive of it because you haven't taken the vaccine, there are medications that you can take to help you prevent the liver
from damaging
and losing its function.
Okay.
So there is treatment for it.
All right. So yeah. Yes, go on. Ask for the hepatitis.
So about hepatitis A and E.
Okay.
With proper sanitation in the environment and proper waste disposal, we can even prevent its transmission and do away with its consequences on the human body.
Right.
So we need proper good drinking water.
Okay.
Not be drinking contaminated water. Waste disposal must be properly done, and in that way you can eliminate hepatitis A and E.
Right.
So hepatitis is largely curable.
Right. But I mean, why? But most people who visited health facilities, met physicians and what have you, people I have encountered who have actually been exposed talk about the fact that they get told that, okay, it's chronic hepatitis, it cannot be cured, all you need to do is manage it. Have you heard similar stuff?
I've heard several of these from many people, and I've told them that if we do the labs and we see the stage at which it's gone, if it's not turned to a cancer, you are not in the cirrhotic stage of the liver and the rest, it could be managed.
Right.
If you come very early and the liver is not damaged beyond reversal,
okay,
you could be saved. But if you follow some of these people and stay too long and the liver gets so bad, and you come, that one will tell you it's not reversible. It can be cured. But as I've explained, you can realize that they can be cured. They can even be prevented.
Yes, by taking the vaccine.
Yes, by taking the vaccine. So if you do the test for hepatitis B specifically, the surface antigen, hepatitis B surface antigen will never clear from your body until you die. That doesn't mean that you are having hepatitis B. It means that you were exposed to the hepatitis.
Right.
You've been cured of the virus, but there's a marker on your body to indicate that you've ever been exposed to it. So just take precautions not to acquire it again. And you can release okay. They will do the profile to see whether it's a chronic non-transmissible or it is an acute transmissible one. If it's an acute state, we treat you for acute hepatitis B. And definitely we'll take you to a chronic non-transmissible, non-replicable. Meaning that the virus is no more in your body and cannot replicate. It's only a signal of it that is in your body to indicate that you've ever been exposed to it. That's what it means.
Right, so that means it doesn't cause harm or damage the liver.
No, once it is chronic non-transmissible and it cannot replicate, it can't do a viral load and find it. So it means you are okay. You only need to live a healthy life.
Right. Great. You talked about transmission as well. What are the modes of transmission? Is it sexual intercourse? What?
For the transmission, we have mainly through blood.
Okay.
Through, that is especially for hepatitis B and C.
Okay.
And for the A and then the E, those ones are transmitted through water and other things.
Okay.
Fecal matter to mouth. So if you are drinking water or eating food that has been contaminated with hepatitis E and hepatitis A, you definitely get it.
Okay.
For B and C, you need to have some blood transmission or sexual activity. Directly, like mother can transmit to child if the mother is hepatitis B positive. That is a blood transmission.
Okay.
People who do tattoos, piercing, going to barber shop and they use
needles and stuff.
A razor on somebody and use it on you, and the person was infected and it got infected.
Right.
If they use it on you, then you can also acquire it. Maybe some circumcision, some practices of circumcision could also lead to it. Maybe the person who is doing it has hepatitis uses the knife for several people without disinfecting it. You can acquire it. Sharp needles, people who exchange needles for drug purposes, can also cause this. Household objects that are being used by several people in the house, like shaving machines, I shave my beard and you also come and take it and shave. If I have hepatitis B active, you may get it as well, like the razors and brushes and earrings. Something like syringe and needles at hospitals, if they are not well disposed, to take somebody,
right,
or you are trying to do a procedure on a patient with hepatitis B or C, then he shakes and you prick him and prick yourself, you could get it as well.
Right.
But the other one is sexually transmitted. If you have sex with somebody with hepatitis B or C, it is possible that you can get it. Homosexuals can also get hepatitis A and C through having sex, because it is transmitted through fecal matter. So if you have sex with somebody with hepatitis A and C, you can contract hepatitis. You can contract them, as well as also contract hepatitis B and C through sex.
I'm speaking to.
So these are the modes of transmission.
Okay, I'm speaking
blood
to.
Blood transfusion can also cause it if the blood is not well clean.
Okay, right. I'm speaking to Dr. Thomas Winsum Anabah. He is telling us about hepatitis right here, and a very important topic. He's the executive director of African Center for Health Policy Research and Analysis. My colleague is here. She also has a question for you. But before I get to her, is there a possibility that the body, the immune system, can heal itself from hepatitis?
Yes, there's a way. Sometimes when people get it, they don't know that it goes, because there's a large number of people in the world who have contracted hepatitis and they don't know they have it until they go to do some routine tests. For medical fitness for work or something, and they realize that they have hepatitis B or C. And when they go to do the viral load, they say there's no replication. It means that they have acquired it and they are failed by themselves.
Right.
So it can happen. The immune system can battle it for you.
Okay, but when you make but when you conduct the test, it means that what do you call it? It shows that you've had it before. Is that correct?
Sure. It will show you had it before. But when they do what we call the viral load is to see whether the virus is still alive and can multiply in your body. When they do that test,
all right,
some of them, they find out that the viral load is zero. Because there's no replication. No, they don't give birth to new ones. So it means that your body was able to manage it for you.
Okay. Epiphania, my colleague here, has a question for you. Epi, go.
Hello, doctor.
Hello, good afternoon.
Good afternoon. Yes, please. I wanted to find out, here in Ghana, I realized that looking at the African region, when it comes to the World Health Organization, most of them have implemented the birth dose vaccination. Do we practice that here in Ghana? And is it part of the national strategy we're using to fight hepatitis?
Vaccination in Ghana for hepatitis, I think the B is one that is very prevalent, but it has not gone very wide. I know kids are getting a vaccine for hepatitis B in the country. For the A, I've not heard about it. Selected people in selected private hospitals giving hepatitis A vaccine to some clients, but it is not in the national framework or strategy for immunization to have everybody vaccinated against hepatitis A. The B, they are encouraging people to do it themselves, but it is not under government strategic plan to have everybody vaccinated against hepatitis B.
Okay.
Wow.
So, all right. Thank you very much. But before you go, quick one. I mean, so let's talk about the level of awareness. I mean, you meet people, I mean, patients with conditions every now and then. How aware are they, or in Ghana and Africa generally? How aware are people about hepatitis?
To be frank, very few people are aware of hepatitis. If not because of that, those who go looking for treatment elsewhere wouldn't have been going. When they come, we tell them they are not aware of it. So we really think that some research that was done about 3 years ago shows that 2 out of 3 people in Ghana were not aware of anything about hepatitis or hepatitis in general. So the awareness level is very, very low. There is a need to use the public health department and the Ghana Health Service at least to run down this information to the people to be aware of it and make testing very accessible and cheap for everybody to test for yourself, know the status, and that way we'll be able to minimize it.
The spread. So lastly, what would be your advice? I mean, years of experience, you've been in this field, and I mean, you're still contributing. What would be your advice in the fight against hepatitis?
My advice is that government, for instance, should make it one of its objectives in its immunization strategy. To make sure all Ghanaians who are born should get the vaccine from childhood. All those who are adults and have hepatitis B test negative should have the vaccine given to them. In that way, we'll be able to minimize the effect of hepatitis B in the country. All those who think they are capable to go to any place to test for their hepatitis issues and get the vaccine done to do that so that it will be able to protect them against the dire consequences of the hepatitis.
Dr. Thomas Winsum Anabah, thank you very much for joining us on the Africa Daily Show. We're looking forward to speaking to you and, of course, other health-related matters in the future. Thank you so much.
Thank you for having me.
Okay, and that is Dr. Thomas Winsum Anabah, Executive Director of African Center for Health Policy Research and Analysis. I mean, taking us through, I would say almost 100% all there is to know about hepatitis right here. And as you've heard, you need to at least make time to just get yourself to the medical laboratory and get tested. Hafiz?
Yes, quite the education there. Yeah, and but it was refreshing to brush up on the few things you know and also add a few things you actually didn't know about it.
Exactly.
Yes, and the thing with his presentation was, listening to him and listening to how he's comfortably he's able to, tell you this is a symptom of A, symptom of B, symptom of, to be able to do it. I'm not sure I'll be able to do it, without mixing things up. But quickly, he provides some very disturbing numbers. Yes, as far as the infection goes and everything. And to put, and I'm not about to make things any less disturbing. I'm even actually going to make it
worse. Then
make it worse.
Put fire to, or more petrol or kerosene to the fire.
Yes. Right now, because just for some context, now globally, hepatitis kills a person every 30 seconds.
What? 30 seconds?
Yes, and annually, we are talking some
200,000 people,
yes. Now, in Africa alone, we are talking 70 million Africans. So
70 million Africans?
Yes. So those are the numbers in there when we are talking about, hepatitis and the rate of infection. Now, on the back of this, the World Health Organization in 2016 decided that, let's try to, eliminate this by 2030 or 2030.
2030.
Yes. Well, ask yourself.
9 years from now.
Yes. So now, if you go ahead to even look at it now, and the way we've tackled it so far, yes, I would say we've paid a lot more lip service to the whole thing. Yes, because of the 47 countries in the World Health Organization Africa region, we are talking 28 that have just developed a national plan. 28 countries.
In Africa?
Yes. Wow. And of the 28, it's even more worrying. And of the 28, just 13 have actually disseminated or done something about it.
Whoa.
Yes. And so these are the numbers there, but it's not all doom and gloom.
Okay.
Yes, there are some very interesting positives actually.
Right.
Regarding the fight against hepatitis.
Hepatitis.
Yes. Now, if you look at cases involving countries such as Cape Verde,
Okay.
Uganda, Rwanda, and all that, they are doing really well in tackling it. Now, they have committed more resources to ensure in 99% dose vaccination rates. Yes, and also provide free national hepatitis B and C treatment.
Free?
Yes.
Wow.
Now, in Cape Verde in particular, they have maintained almost a 98% vaccine coverage.
Wow.
Yes, of that. And lastly, there are some good news. And as far as tackling goes, when you talk about Madagascar and South Africa, yes, with the use of or with the help of mobile clinics every now and then, they have increased access to
moving from
vaccines.
household to household and all.
And yes, and all this is all down to the government, like you mentioned. Yes, a deliberate plan to
having a national database to see exactly what's on the ground.
And in the case of South Africa, I want to think it's the HIV prevalence rate in there is quite high. Yes. And so they've made it a point for pregnant women exactly when you talk about antenatals and they go for antenatals in terms of screening. Hepatitis is the test for that is
even here in Ghana. It's actually a test you actually have to undergo.
Oh, okay.
Alongside HIV. Yeah.
So, but how? Okay. So they talk about mobile clinics as well.
Right.
So you're not just trying to go to the health centers. They actually get these facilities and screening services closer to you by seeking you out. So those are actually some of the efforts they've made towards and in the fight against hepatitis. Yes.
Right. Have you ever thought about going for a test?
A test? No, I'm not exposed. So.
How do you know?
I know.
That's the thing Doc was saying.
I know.
Okay. You see people.
I'm very confident.
Be an exemplary man.
I'm a good
anyway, let me get to Epi.
I'm a good boy.
Barry.
Hepatitis.
Yes.
Have you tested?
Yeah, I think I've taken 2 of this thing.
Yeah, you're supposed to take. Is it 2? You're supposed to take 3. 3 doses.
I think I've taken 2. I can't remember whether I actually did go for the last one or no, but I've gone twice for this thing.
There's a duration.
Yes, I'm sure I did.
Don't worry, you start over again. It's fine. Yeah, that's it. I'm still trying to figure out our COVID brothers and sisters. Anyway, tell me.
So yeah, I asked him about the birth dose thing, and yes, as much as Hafiz mentioned that about 13 countries out of the number in the Africa region that have actually implemented the taking up national strategies, not all of them have implemented it. You have 3. You're looking at Rwanda, Cameroon, and Mauritania. These are the countries that are actually implementing the bed dose. And with the bed dose, if the child is born, given 24 hours, it must be given the dose, the vaccination.
Right.
That is able to save the child's life. But then after the 24 hours, then it becomes a problem. And I mean, you're looking at, as much as we have other issues or diseases, hepatitis has like over 1.34 million deaths attributed to it yearly here in Africa. And that's really a disturbing number.
Not good at all.
And just the hepatitis B, you're looking about 68,870 people dying from it annually.
Hepatitis
B, just the B. Just the B.
I'm surprised actually. That's someone would call it the silent serial killer. Yeah, you'd never know. You'd never know. But I'm happy he made mention of the fact that within a week or 2 months, period, you should be able to start seeing the symptoms. And if you already have an underlying condition that actually has an effect on the liver, you may see that earlier. But anyway, great. Okay.
Also, with Egypt here in Africa, Egypt actually has one of the world's largest hepatitis C epidemics. You're looking at nearly 40,000 people who are dying each year of liver failure associated to the hepatitis issue. So one thing they've done is they've actually upped the whole hepatitis testing game. They actually have people screening yearly for hepatitis, and they actually went further to provide hepatitis C testing kits and treatments for 1 million people in 14 African countries. I think that was a good gesture.
That's a good move,
picking from their own personal experiences and ensure that they want other countries to also go through what they're going through. But I think it's very important that we take the birth dose, the vaccination.
Very serious,
because if the baby is vaccinated at birth,
then you don't have that trouble.
Exactly, it avoids that. I'm just disappointed that it's not under the national thing here in Ghana. And well, how can I say? I mean, looking out of all the number of countries, the 28. I mean, you just had a few people implementing. I feel
and this even out of the bigger picture of 54 countries.
Yes,
you know?
So I think it'll be important if we start implementing and. It's not just about putting the paperwork down. It's about putting the action to it.
The future generations shouldn't get into the same mess that's already existed, and there are still more other complications setting in. I mean, COVID is here now, so yeah. But anyway, we pray for a better day. Better days in the future. Thank you very much, guys. That's all we have for our discussions and very interesting conversation. Is all about hepatitis today. It's World Hepatitis Day. So if you haven't tested, please go test. If you're negative, get the vaccine. If you're positive, it can be cured, per what doctor said. And don't let anybody deceive you that, hey, it can never be cured and everything. But then the thing is, seek treatment at the right place from the right people, okay, qualified physicians and all of that. Don't just go start taking quack stuff and then you end up having complications that could have been prevented.
If you enjoyed this video, don't forget to like it, subscribe and share.